My fellow Californians, stop and listen. Now, more than ever, we're relying on your voice to help thousands of undocumented immigrants gain access to health insurance in the United States. My name is Tania Navarrete. I am a first-generation American citizen born and raised here in California. As Californians, we have always taken pride in our progressive policies and the progressive culture that we constantly strive to improve. Our society is run by dreamers, from the Europeans and Asians that migrated during the gold rush in 1849 to the more recent influx of Latin American immigrants we see today. As you may or may not know, Governor Gavin Newsom recently signed to freeze enrollment to Medi-Cal for undocumented immigrants here in California starting in the year 2026. Medi-Cal is one of the only medical assisting programs that help undocumented immigrants gain access to preventative, crucial services. We're talking about neighbors, church members, the people that harvest your crops, and the parents of your children's classmates. This presents itself as a major issue as, according to a report published by the Public Policy Institute of California by Iwenza Ugo, most of these people aren't covered by their employers because they tend to work lower earning jobs in agriculture or construction. As we all know, health insurance in the United States can vary from hundreds of dollars to thousands of dollars a month. We must remember that these people are pushed to the lowest earning jobs in our society due to a lack of the English language, or a lack of social security number, or a lack of education, amongst a lot of other factors. With that in consideration, it remains highly unlikely that many of these people will be able to afford health insurance with out-of-pocket money. However, even before this blow to the face by the California State Assembly, a report from the UCLA Center of Health and Policy found that approximately 520,000 undocumented immigrants still didn't have access to health insurance despite expansion of Medi-Cal. Why, you may ask? Well, let's take a look at Medi-Cal's eligibility requirements. A family of 4 must make $44,367 annually to even qualify for Medi-Cal. Unlike U.S. citizens, undocumented immigrants are ineligible for covered California, meaning they can't negotiate cheaper insurance plans through health insurance markets. This is an extremely narrow requirement that leaves many people uninsured every year. So, why should you care? 1, these are humans we're talking about, equally deserving of life as you and me. Preventative care is essential to the early diagnosis of life-threatening conditions. A report by the Bay Area Council Institute and UC Merced found that approximately 50% of these undocumented immigrants have lived in the United States for over 20 years. The same report found that undocumented immigrants contribute to approximately 5% of California's GDP and nationwide $23 billion in taxes. If these people are actively contributing to our society, just like you and me, why should they be any less deserving of health benefits? It's unfair and disgusting that we continue to prioritize some people